This is the Horse Radio Network. This is episode 36 of the Stable Scoop Show on the Horse Radio Network, Vet Talk with Dr. Parrott. We would like to thank our sponsor, Equestrian Collections. Equestrian Collections brings the whole universe of equestrian shopping to your fingertips. You can visit them at equestriancollections.com.
Welcome to the Stable Scoop, with weekly shows delivered right to you. With Helena and Glenn the Geek, live from the stable, it's every week. They'll bring you the news through hail or high water, while using their tails as their own fly swatters. So sit on down and laugh till you poop, cause it's time again for Stable Scoop. Stable Scoop. The Stable Scoop. Stable Scoop.
This is Glenn the Geek.
And this is Helena B., and you're listening to the Stable Scoop Radio Show.
Well, Helena, are you very excited? Helena is making her way down here to Lexington at the end of this week for her first visit to Rolex.
I am. I'm very excited. I'm excited that the weather is going to be beautiful.
Yeah, it looks good, actually, so far, knock on wood. It can change down in Kentucky. They say if you don't like the weather, come back in 5 minutes.
Yeah, they say that about New England, too.
Yeah.
Only I think the weather change down there is a little bit more tolerable than the weather changes up there.
That's true, except for the tornadoes and things like that.
Stop, okay? Stop, because then I just won't come.
No, we are looking forward to having you staying here at the house, and it's going to be a lot of fun to have you over and spend a little bit of time with you watching cross country and stadium jumping.
Yeah. I don't know if I'm more excited to hang out with my best horsey friend Jen, or if I am more excited to see Rolex, because
make it equally excited.
There's nothing quite like hanging out with your best pal talking about all things horses.
Horses, and there's no better place to do that than in Lexington, Kentucky.
I know, I'm so excited.
Well, I wanted to mention to everybody that we have our Rolex coverage this week. We are doing extensive coverage, probably more than anybody else has ever done for Rolex. That's over on the Eventing Radio Show at eventingradio.com. We are doing daily podcasts starting on Wednesday through Sunday. We'll be doing putting out podcasts each night with interviews of all the riders and people that are there and fun interviews, and then Chris and I will be doing a daily wrap-up show with a rider every night, talking about the events of the day and what the scores are and keeping you up to date that way. In addition, the United States Equestrian Association, we're working with them. They're going to do video of activities during the day and of the press conference at night. They have a press conference for the riders, or the press, every night. And then they're going to record our daily wrap-up show. So that'll be put out in video form every night. And then also we are doing... Yeah, I know there's a lot of stuff here. We have a ex-professional eventer from England who is joining us to do a live blogging format called Cover It Live. She'll be actually doing play-by-play all day long that you can follow on our website. So she'll be talking about the rides and what's going on. We can't provide video because of the restrictions that NBC has on their coverage, but she will be doing live blogging all day, and you can interact, you can talk with her, discuss your favorite riders. It's just going to be like this rolling forum all day long.
Cool.
So that'll be a lot of fun. That starts Wednesday at around noontime. So check that out, Wednesday the 22nd at eventingradio.com. And Helena, who do we have with us today?
We have Dr. Brian Parrott, and we're going to talk to him. He's obviously the star of our Ask the Vet show. Dr. Parrott hails from the North Shore. He's from my area. He received his DVM from Tufts University School of Veterinary Medicine back in 1987. And since graduating from vet school, he's been an equine practitioner, like I said, in Boston's North Shore. And in 1991, he founded Parrott Equine Associates, which has 3 practicing veterinarians. And their special interest is sports medicine. But of course, they provide overall health care to horses of all kinds, eventers, dressage horses, hunter jumpers, backyard horses, you name it. Brian's professional, Dr. Parrott, his professional interests include sports medicine, lameness, podiatry, which I can attest to. He's fabulous, reproduction, and dentistry. Dr. Parrott has contributed his expertise to publications such as Practical Horseman, and he provides lectures every now and again on equine health. I know he's done some great work with the MSPCA up here. He is a native of Rockport, Massachusetts. He grew up riding and caring for horses, and in his free time, he enjoys polo and fox hunting. So he's real cool in my book.
All right, cool. And we'll get to Dr. Parrott, and we have a lot of questions for him, so and some that were submitted by the listeners that we want to get to. We'll get to that in just a moment. Just wanted to mention to everybody, don't forget that you can sign up for our giveaway. We have some cool stuff this month. We have a $75 gift certificate from Equestrian Collections, and we do appreciate Equestrian Collections donating that. You can choose from their whole universe of equestrian products right there at equestriancollections.com. And the second item is from EasySignsOnline.com, and they are a leading farm sign company in America. They have donated 3 custom stall plates. 3 winners will get a personalized stall plate from EasySignsOnline.com. You can use them for your horse's stall, for your dog house, for whatever. Just get whatever you put one on it. They're customized and come in a multitude of colors. And we thank EasySignsOnline.com for donating those. To sign up, go to StableScoop.com. Just on the right-hand column, you'll see a place to sign up to win. It's free. It's easy. Just go in there and register, and we'll pick a winner at the end of the month. So don't forget to do that. Also wanted to mention that, as everybody probably knows, the World Cup just ended out there in Las Vegas for dressage and show jumping. And Equestrian Life has some great videos done by my co-host Chris Stafford from the Eventing Radio Show, and she got to interview a lot of the leading riders. So you can check those out at equestrianlife.com. Go to right in the homepage, it says World Cup, and you can find the videos from that. And we're going to get to Dr. Parrott in just a moment. I thought we'd get all the business out of the way, Helena, and then we'll just start right in with our questions. We won't have to be interrupted.
Oh, business, business, business.
I know. One more piece of business, and that is our sponsor, Equestrian Collections. Helena, they do the coolest stuff.
All right, this is good business. This is the kind of business.
That's right. This is the kind we actually get paid for, and we encourage all our listeners to please support our sponsors. That's the reason we can bring you these shows and bring you people like Dr. Parrott and the conversations that we have. I wanted to say that Equestrian Collections does bring the whole universe. They have tons of stuff on their website.
Tons.
I know, tons. She says at any given day they have over $100 million of product for you to choose from. I didn't even know there was that much horse product out there.
Oh, yeah.
And you know what? Riding takes up a lot of your time, and Equestrian Collections is open, obviously, 24/7 at equestriancollections.com, and their technology is so cool. I mean, you can check out in no time. They do a great job with their technology. They're one of the best in the industry as far as that's concerned. So you'll have an easy experience on their website, but they did the coolest thing I got last week. I don't know if you know it, but it's my birthday on Friday. And 2-3 days ago, I got an email from Equestrian Collections saying, happy birthday. So at some point in the registration process, I must have put in my birthday. I don't even remember that. But I got an email from them saying, happy birthday. Here's a $10 gift certificate that I could use on anything I wanted for any amount I wanted. In other words, if I had just bought $10 worth of stuff, it wasn't $10 on $100 or more. It was $10.
$10 off anything. I like that. Simple
and just because it was my birthday. And I'll tell you what, you don't get that kind of thing from anybody else.
No.
That's the kind of people they are over there. They care about you. They care about your horses. And, that just impressed the heck out of me. So we encourage you to stop by Equestrian Collections. And you know what? When you do, go to equestriancollections.com and you're checking out, put a little note in there that you heard about Equestrian Collections here on the Stable Scoop Radio Show.
Yeah. We're big fans. Even if they didn't pay us, I'd be a big fan.
That's right.
I was a big fan before. That's how they came to be a sponsor. We were big fans.
We were big fans, and we actually had them on the show before they were sponsors. That's how much we believe in them.
Yep.
All right, well, let's get to Dr. Parrott. You already did his introduction. He's a really cool veterinarian from the north part of Massachusetts. Did I get that right?
Yeah. Well,
all right, let's say hi to Dr. Parrott. Northeastern. Okay, let's say hi to Dr. Parrott.
Hi, Dr. Parrott. Thank you so much for joining us on Stable Scoop today.
Oh, you're welcome, Helena. It's very nice to be on this show.
Yeah, Glenn and I are we're pleased to have an expert because he and I have been pretending to be experts for the past 6 months. So
hey, wait a minute.
To have someone in official capacity.
I'm glad that you think I'm an expert. I'm not sure how many of my colleagues will consider that, but
Well, let's see what happens. Let's ask you some questions first, and then we can answer that. So the questions we have for you today, Dr. Parrott, are about horse care in general. But before we get on to that, some of our listeners may know, or they may not, that there was an unfortunate tragedy in Florida in the last day or so, and it had to do with the deaths of some polo ponies. What do you know about that, and what are your thoughts on the situation?
well, it certainly sounds like an awful tragedy. Anytime you lose a number of horses and so suddenly and for no apparent reason, it brings a great deal of concern to the whole horse community. In a situation like this, I know that the owners, the caretakers of those animals, the professionals that ride them, are probably extremely distraught, and of course the whole horse community is going to feel this. My first thought is that everybody needs to be compassionate, not lay blame, and be patient, because with that many animals, a clinical diagnosis will be able to be made. It will take a little bit of time and a little bit of investigation. And from what I've read, excellent people are truly involved with the whole case, right from the veterinarian that was involved immediately at the Polo side, Dr. Paul Walleman, and his practice, Palm Beach Equine Clinic, had to deal with these cases immediately, and they did all the right thing. So I've received information about their hard work in trying to save the animals, as well as get the information, meaning doing the tests that are necessary to find out the cause of the deaths of the animals. And they're working directly with the Florida State Agricultural. I'm not sure exactly what agency, but the agricultural agency of the state, and very closely with them. And I'm sure they will be working with the federal groups to toxicology samples and tissue samples very, very closely. And I'm quite sure that the University of Florida School of Veterinary Medicine will be involved in it as well. So they're doing all the right things, and that just takes the information to be gathered, and they're being very smart and thoughtful about not giving any information that isn't complete and true information, so it doesn't start rumors.
Right. Now, there aren't the same regulations in the sport of polo as there are in other equestrian sports. Does that have any? Are there, besides obviously the sadness and the financial loss, are there any other repercussions what is the governing body? Is the U.S. Polo Association involved? Who is the equestrian body that might be overseeing this situation?
The United States Polo Association, very strong and very well-run group, have the sport of polo, the animals, all at the best interest, and they're the ones that try to develop a criteria, rules, regulations for the sport, keeping in mind foremost the health and well-being of the horse. Keep the sport going and perpetuate it, but they work very, very hard to try to give polo and do the right things that make polo not seem like a sport that is abusive to animals or to the horses. And they do a good job. It's a private agency, and there are probably in the competition world less regulations when it comes to medication, but all other aspects of it, the cleanness of the sport, as far as having referees, people that oversee that the animals are not getting injured and that people are playing the sport. So it is regulated from one perspective. There is less regulation when it comes to medications and USPA sanctioned events. There's language that states that animals should not be mistreated, abused, probably medicated. I would need to consult with the rule books, USPA rule books first. But my thought is that is their intent, and the problem comes from regulating the lack of people to regulate sanctioned events on all levels, medications and so forth. So, like in the U.S., in the HSA, there are very strict regulations that have been adopted across, and the governing bodies, U.S. States as well as federal, have accepted that they set they make the standards for rules and regulations.
Yeah,
and I'm not.
And I think the thing that's hard, though, is you can have all these rules you want, but unless there's like thousands of people around the country to test for all of these things during all the different competitions, it's almost impossible.
That's very true, and that's where the problems come from. So, this is going to be looked at extremely hard from the USPA about if there's any fault here of maliciousness or accidental drug abuse. This will be looked at extremely hard and potentially, action to make more strict regulations. If it's something other than that, then rules and regulations aren't going to change and may not be necessary. But I hope that it is.
Yeah, I mean, they're still talking about it could be tainted food or vitamins or supplements or a combination of the three that caused the reaction. It obviously had to be something they were all given at the same time for it to happen. That's just very unusual.
For the same group of animals, right?
Yeah, I mean, all at the same time, and it's so quickly. I mean, that's the other thing, is it appears from what I'm seeing here that they all went within a couple of hours of each other.
That's right. You think of things like bacterial endotoxin, which could be foodborne, medication-borne. It could have been in the water source.
Yeah.
Even if the cause isn't, is because of somebody's carelessness, or it just doesn't feel like anybody intended for this to happen.
Right.
We do things. We all do things that aren't maybe the best. We follow old wives' tales, or we don't want to let go of some, like you said, old school traditions and treating our horses and things like that. And my guess is that happens in polo as well. But it doesn't. Every once in a great while, something goes wrong and makes us look at those practices, revisit them, and hopefully change it, get rid of it. My feeling is just that this is one of those things that went horribly wrong. It probably is done quite a bit, and in this one case, it went really wrong. I mean, I guess I don't know if I'm hopeful for that, but that's just my gut feeling.
Well, I'm sure that the investigation will yield the underlying source, and it will be well reported. And if there are any wrongdoing on behalf of people involved in the horses, I'm sure that they'll be prosecuted to the extent of the law.
Yeah.
All right. Well, let's get on to a little bit happier note, and that's all of our listeners' horse ailments. Is that a happier note? I don't know about that.
Well, not ailments. Just preventative health. Their ailments or their horses' ailments? Because I got a whole list of their ailments.
That didn't come out right. Let's just say, okay, so in your experience, Dr. Parrott, what are the top 2 mistakes that horse owners make in their health care program that really compromises their horses' overall good health?
Well, there are a few things, and I would say that 2, in my opinion, are that not having a working dialogue with their equine practitioner. My experience has been that some clients just don't feel comfortable having an open dialogue with their veterinarian. And I have found that those people that do are ones that are, easier people to work with. They learn much. They have a greater understanding of what I do. They make less mistakes. They over time with their pets, and it likens itself to newborn moms with their newborn children. Some are much more proactive about learning and communicating with authorities, and some are less. And those that are the animals are usually in excellent health. So that's one of the biggest mistakes I see of horse owners is the horse owner that doesn't utilize their equine practitioner. And it shouldn't cost them money. They shouldn't be afraid that it does at the same time, because most of us are very happy to educate our clients. They make them a much better client, when we are dealing with legitimate problems, they truly are legitimate problems and not because they're well educated because of our dialogue.
I'll tell you what, my wife has, Helena will know this, Jennifer, and you've worked with her actually in the past too. She's not afraid to ask 1,000 questions.
No, and it's good. And if you don't have a good relationship with your equine practitioner, go find one that you do, because there's so many avenues for doing that now too. I mean, you can pay for verbal services, consultation services now across the country, but establish a relationship that you're comfortable with doing so, and there's no excuse anymore, not because we have so many means of communication. So that's the first. The second one is, and I had one other that is up there too, but buying into gadgets, gizmos, and stuff to make their horses better than they are. Thinking that, and it's like us, you want to be you're a runner, you want to be a good runner, and so you start buying into all kinds of devices that will make your running better, be it shoes or clothes or something else, and you're really into that. And I find that a lot of people are really excited about taking chances with their dollar on trying stuff. And it just takes a very simple marketing scheme to sell people stuff. So my biggest problem, or one of the biggest mistakes I see people doing, is buying stuff, junk, trying it before consulting with authorities.
Like give me an example of junk.
Junk. Certain and things that could actually lead to some harm. Things like certain types of bug sprays, say. Yeah. Food supplements.
I was going to mention supplements. You have to wonder if we aren't over supplementing. I'm sure you probably think we are.
The supplements are one of the biggest money makers in animal nutrition, be it horses or any other, and they do extremely well because they've become accepted. The area has been bombarded with advertisements, and people after a while start to buy into it. Right. And there's a little bit of information that's honest, true, and well researched, and the biggest problem that I see is that people then will take a little bit of information and something that works a little bit, and they hope that it will have a panacea of effects. And I see people spending a gross amount of money on things that are really ultimately ineffective and just a fad. And we've seen it over time with all the products that are out there, if we've been horses or other pets products for years and years. So I would say that's the second largest mistake a horse owner might have. And
you said you had a third in there that you wanted to squeeze in, maybe.
Yeah, and the other is It's more of a nutritional statement. And because nutrition is such a big concern us, and we do that with our dogs and cats and horses as well. But assuming horses can live on just hay and grain alone, and making generalizations that one diet fits all, or on the reverse, that you have to have a very specialized nutritional program to support your horse. So there's at this comes to nutrition for horses, the beliefs that I hear the beliefs and questions that people have regarding nutrition, and there's just there's not a simple answer to that. It takes time and understanding. This again are mistakes that people have, and they're afraid to ask the authorities, be it an equine nutritionists, we have a lot of them available now in North America. Their equine practitioner, which is to start, and very knowledgeable horsemen who've been in the industry feeding horses themselves for years and years and years. And so utilizing the biggest mistake a new horse owner may have is making assumptions, again, without research and understanding.
Well, it's a good segue into the next question, which is the whole topic of nutraceuticals. They are the latest for everybody, and the drug companies are pushing their drugs, and the supplement companies are pushing the supplements and nutraceuticals. Do any of these nutraceuticals for horses work? And in your opinion, which ones are the most effective? I know they're out there for joints, for their immune systems, for skin and hoof. What do you think about their effectiveness, and which ones are effective?
Good. It's an excellent question. I question several times a day. It's and I have a little bit of a mantra for it. But essentially, there is some evidence that some nutraceuticals work, and you really need to be specific about what agents of those nutraceuticals they are, because there are nutraceuticals by definition are unregulated items, usually of consumption or supplementation, and they have a variety. There's a variety of them. Everything, be it herbal medications, so therefore botanicals. There can be also these more developed type of like glucosamine and chondroitin sulfates, which are some of them are animal biotics that are supposed to be very much like the products that we in our own body, such as our joint fluid. So when we talk about nutraceuticals, there is some evidence, some of them work. It's defining which of those that are beneficial, which ones have been really looked at closely for the benefit of the animal. And the biggest problem is not to overly generalize about. Unfortunately, like I say, these nutraceuticals are defined that way. They would not be. They're not of a great concern to governing bodies like the FDA, mainly because they don't have a significant biological effect. If they did, they would possibly have potential of causing some harm, and the FDA would look at those much more closely. So in general, my feeling is that nutraceuticals are, even if they do work, are probably of low potency, of low value to an animal over a long period of time. And I have a problem with most of them because of their extraordinary expense. What you gain from the dog you put into it, I don't know if you can really measure a cost benefit. but I have a general sense that there are products that are out there that are touted, that are proven to work very well. Some of the nutraceuticals tout that they can do as effectively, and essentially don't.
So does that mean that my wife and I, the times we used kava kava to quiet the horses down, we were doing damage to our poor little pony?
I don't think they're probably doing damage.
Made him high.
Kava Kava did?
Oh, yeah, Kava Kava's a great thing. We had a Hackney pony that was absolutely crazy. And he had been shown, and, he had gone through all the training that Hackney ponies go through. And we found out later, after we bought him at an auction, that he was the Ohio State champion. And he was I loved him to death because he was so much fun to drive. He was like driving a Ferrari.
Oh, yeah.
But the farrier would refuse to work on him because he'd stand straight up on his hind legs the entire time. And he was only about 12 and a half hands. He was a little thing. So we used Kava. Oh, it was great because it made him just high enough. It doesn't make him high. I sort of equated it to what's that drug they give kids to Ritalin. Because it makes them focus on one thing, instead of being skitsy.
Right.
And it worked for him.
Right. And those really shouldn't be considered a nutraceutical. That is, a herbal, botanical, medicinal. And,
so is marijuana.
Exactly. And
Exactly.
Yeah. And it's highly effective for a number of things. And
right.
The biggest thing is a lot of these haven't been tried in animals or the horse or under those circumstances. So we always know about drug interactions with other drugs and their effect on that in itself.
I mean, you're right. Marijuana is highly effective for helping you get through college.
I have many colleagues that needed it.
Well,
now that I've taken this show right down the drain,
botanicals, we can just relabel it from drug botanicals.
There you go.
That's a whole nother show.
Well, and those are things. So we need to define, cases of nutraceuticals. Nutraceuticals should not be considered botanical and herbal medicinals, and they are being added to some of these nutraceuticals. So the definition, the word nutraceutical is being redefined, and that needs to be. That's one of the concerns I have about making a word and making it too generalized. People need to be very specific and understand. But of course, there's very little regulation, and putting some of these together. These herbals are not necessarily FDA approved and not very well understood. So you mix those, all this other stuff, and sooner or later you do run into a real negative drug interaction, and that's happened. It's been many, many times over the years. We've had nutraceuticals, medicinals, I should say botanicals and herbals that have interfered with the drug treatment by a veterinarian, and the animal has suffered for it. And so big problem, big concerns, and most of us don't know really how they work well because they haven't been researched, and that's the big thing about nutraceuticals is that some are researched well and for the purpose that they were designed for. Unfortunately, a lot of people will work for a panacea of problems, and the companies would love that to happen. Right. And because of that lack of regulation and understanding, people are buying into a bunch of stuff that doesn't work. And my advice is if you're going to use products for joint supplements and hoof supplements, that you buy the industry, from the company, the manufacturer that sets the bar, the industry standard for the product, that has done the research. And because there is no regulation about quality control other than, so when people go to buy Cosequin, which really set the gold standard for nutraceuticals and joint supplements, invested a tremendous amount of money into their research, and they got some decent results. But everybody else, the other manufacturers, jumped on the bandwagon, saying they had the same product, they had the same types of stuff in it, but they'd enhanced it with MSM and these other additives. But they didn't go on and say their product was as good. There was no quality, and were they actually putting in what they said that they're putting in? And there's been some really revealing things over the last few years. A lot of these companies that were trying to compete with the Cosequin market, they were producing junk, and people thought it was working as well as Cosequin or better. So, that's a big concern, and advice to clients is stick with the manufacturers that have put the time and effort into research. Make sure that you understand the research that you ask your veterinary professional, again, because that's one of the things that we're trained in doing is the body of evidence to say a product is good or not.
Will you recommend it if you've got a client and a horse who you think needs it, or if they talk to you about it? Will you engage them in discussion about these and kind of lend your advice?
Yes, I do. Okay. I do, and I usually, when I recommend something, if it's like a joint supplement, there's been some very good evidence that glucosamine at 10,000 units per day is a helpful nutraceutical to joint damage. And that's a generic product. You can buy that from anyone as long as you're confident that manufacturer is, producing a good glucosamine product. And then there's, Cosequin, which they really stand by their manufacturing process and the quality control that goes into saying, what they put into their product to be there. And there's some, good body of evidence and research to support that manufacturer and their practices. But there's an awful lot of companies out there that are trying to underprice, and they just haven't done it. You say, well, it's the same thing. It's got 10,000 milligrams of chondroitin sulfate and 10,000 of glucosamine, and that's Acme brand. That's Acme brand. Why shouldn't we buy that? It's $100 cheaper a month. And do you really know it's what it is? Nobody tests those things, and some are probably okay, and some are not, and you just don't know that. That's why I say stick to the brands that have done the research and the time, and stay away from all the others, because they're just, again, no regulation on that industry, or virtually no regulation on that industry.
Okay, all right. Good advice.
We got an email from a listener, take it a little bit different direction, that said, my neighbor's horse had a hoof abscess. She says it happens once a year in the springtime. What might be the cause of this?
That's an excellent question. That does happen.
Really?
Cyclically from some horses. And it's usually twofold. One is environment. That horse is probably staying in the same environment year after year. And the allowance of that hoof to develop cavities in the hoof. And that, in part, is associated with the owner being due diligent about making sure that their horse's feet are getting proper care and timely care. And sometimes the hoof provider, the horseshoe or the horse trimmer, some are more diligent about discovering cavity in feet than others. Some will see a big, huge cavity or cavitation or separation in the hoof wall, in the lamina, and not probe the depth of the recess where the dirt is packed in and things like that. And one of the things I do in my practice is when I work with farriers who have take care of patients of mine that have chronic hoof problems, either from the environment or poor quality, and are more subject to abscessation, is teach them that when they come to trim the horse on a routine basis, that they probe all of those. And I give them hypodermic needles, not that they need it, sometimes, because they act as a great tool to drill and find the depth of those. And if they find that they're deep, and the reason I do that is because they often put a shoe over these cavities, and of course that just seals in perfect environment for a cavity to get deeper and worse, like the teeth of a human.
Right.
You know, cavities. The hoof is not much different. When cavities form, that's where bacteria set up, and the bacteria, fungal organisms, and the byproducts often are able to eat into that collagen and work their way into the sensitive tissue where the body recognizes that there's a foreign body in there and attack it to try to clean it out and get the infection out.
The difference is you don't carry one of those nasty-sounding drills like the dentist does.
yeah. Well, I do. I actually do.
Oh, you didn't have to tell me that. I got a question. We had Percherons, and Percherons are my favorite breed of horse. And we had one that ended up with, and I'm sure you've heard of this, Percherons are predisposed to having these chronic abscess, and they'll get it in 1 foot. And I don't know if it's called canker or, but they just get channels through their foot. And we had one that had that, and it was a heck of a fight. And we ended up, we talked to veterinarians, numerous veterinarians and farriers and everything, and then my wife one day said, we're going to have to put this horse down unless I try this. And she just started soaking him in. She made this lime slurry.
Yep.
And she started, and that was an old thing she had read in a 1900 vet book, and cured it in about a month. Now, I'm not recommending people do that. But it is amazing sometimes what things do work, you know?
Well, it is. And then you back out of a discovery like that, reinvention of something that had once been in favor, and you back that out with a little bit of physics and chemistry understanding, a little bit biochemistry understanding, and sometimes you actually can understand why the environment that you are putting them into, that slurry, could be be more and be able to penetrate into the deep recesses of that infection and create an environment that not conducive to the fungi and the bacteria growing. At the same time, not damaging the healthy epithelium in the area. So there are, some great old remedies that are out there, and in time, any of them stick around. A number of us, and I use a bunch of old remedies, again. But a lot of which I have come to a theory of why they work so effectively. And so we can't forget ancient medicine. Those things are really important, but it's always nice to understand, well, why do they work? Because in the past, nobody really could answer those questions. Now we have a lot of tools in which we can say, well, we believe it works because of this reason, because people have taken another step and understood why.
That's a very, very good point. I think I'm going to latch onto this and research it further. So these old remedies work. Many of them work. They didn't know why they work now, but because we have such knowledge of the biomechanics and the chemistry of the way our horses' bodies work, and even our own bodies, that we can understand why they work and say, yes, this makes sense. This doesn't somebody trying to sell me a bucket of goods. This is actually
right. And there's so much medicine that have come to understood because they worked generations or of years ago, and those have been the basis for the exploration of Western medicine and trying to produce products, trying to refine it to something of what the basic principle is underlying why those work. That is the premise for Western medicine developing. Fixing problems, and say, well, why did the remedy work? Well, you don't need, the tar whiskey. What you really need is the acid nature of the product, that type of thing.
Right. Although the whiskey's good to have around.
Yeah, the whiskey's good for the person. I've got a wonderful old poultice remedy I learned, and this is one that I can tell all your listeners because it's a wonderful poultice for hoof abscesses and softening the foot as well as drawing it. And I learned this. I was probably 15 years old, and I worked at Myopia, by the way, and And it came to bear because a horse got a hoof abscess, and I watched it very closely and never forgot it. It was the bran poultice, and the bran poultice was it's a substance that holds moisture, and it dries. When it dries, it actually draws moisture from the environment and then dries out secondarily. So you would moisten bran with 1 ounce of papaya juice, or I'm sorry, apple juice, or you can also use papaya. Anything that has papain enzyme in it. So pineapple juice has that papain. And
so
then,
you were talking like bran mash, like bran?
Yeah,
okay.
Yeah. You take wheat, good old-fashioned wheat bran.
Okay.
That you would feed a horse, and because it's around, you would put 1 ounce of pineapple juice and 1 ounce of whiskey, and add just enough warm water to it just to make it moist. Pack it into the deep sole and recesses of the foot, and wrap it up with a burlap bag. And what that did is the burlap bag, would breathe, so it would eventually, as it was drying, it was drawing on the tissues around it, and was wet to begin with to soften everything, but then it would dry out slowly and have a drawing-like effect, sort of hydroscopic effect. And then the pineapple juice with its enzyme in it would help to get into these deeper recesses and actually eat away at the collagen a little bit, so that any of these recesses would be opened up a little bit. This is what I was told. And then the whiskey was to sanitize, to put some alcohol to offer some sanitation, but it was also good for the person making the poultice.
Well, I was just going to say, and then the person could drink the rest of the whiskey and not care whether the horse got better or not.
And as for you, and as for me, and everybody's happy, and they walk away.
I want to know how a 15-year-old ended up with the whiskey in the barn. That's what
it was myopia after all.
But it works very well. If you ever do that, you take off that whole thing the next day. You leave it on for 18 to 24 hours, and you take it off, and all of a sudden you have this very soft sole, and it's very easy to dig at. And if there was any real hard hole that was keeping the pus from coming through, it softened it enough, and at the same time drew on that pocket. So sometimes you take off the bandage, you see this hunk of pus sitting right in the bran, and
wow.
and it showed you just where it was. Now that poultice has worked better than all of the other medicated poultices that are on the market that I can find. And I go back to that all the time when people have bran in the barn.
Well, I'll tell you what, we'll put that in the show notes. I'll type that up and put it in the show notes at stablescoop.com. So anybody wants, there's the big advice for the day. We can just cut out the rest of the show.
Okay.
And I have all the ingredients. I just need to go get a burlap bag.
Well, the burlap was, everybody, that's one of the problems is that they don't have burlap anymore.
No.
You don't really have a cover that works as effectively. I do use baby diapers, and I do cover the foot with tape on the bottom, but I try to leave as much duct tape off the sides and the upper part so that the moisture can evaporate.
That's right. You wouldn't want to duct tape the whole thing, or you just sealed it in.
Yeah, sealing in a lot of moisture, and it's not drying up fast enough.
Huh.
Yeah.
All right, we're definitely putting that in the show notes.
That's interesting.
It's affordable too. I like to have these alternatives because everybody wants to sell you everything. They want to put a name on it, they want to brand it, and then they want to charge you $100 for it. And
oh yes, yeah, and there's all of that stuff out there. And the alternative for the whiskey is Listerine.
That's not nearly as fun.
Yeah.
It's not as fun. Yeah, absolutely. And every old barn had a bottle of whiskey.
Well, and you don't want to buy the little bottle either. You have to buy the big bottle just in case it doesn't work. Yeah.
That's a trend I think needs to come back. We'll get started on that.
You have to treat the poor horse owner that couldn't ride his horse because he had a hoof abscess. There's got to be plenty around for everybody.
Well, we're a good gang tonight. I got feeding my horse kava, pouring lime on the feet, and us drinking whiskey. We just got is this a vet show? Let me think about that. I do have one question, Helena.
You got to watch out who you ask on the show.
Before we get to the last one, I do have one question. This one's, Helena's going to know why I'm asking this question, because I've had lots of personal experience with it. Lyme disease.
Right.
Of course, horses get it, people get it. I had it really bad, and still do. I mean, I'm still fighting it, and I know there's lots of medical doctors out there that do not believe that chronic Lyme disease exists.
Right.
Or at least, I think there's a lot of medical doctors that do believe it exists. There's a lot of insurance companies that don't believe it exists.
Yeah.
Now, so what are your thoughts? Have you seen horses that you really believe that the round of antibiotics didn't work and that they're really fighting this?
Yes, and I deal with it a lot because I'm in the Northeast and it's endemic.
And it's spreading across the country. It's everywhere now.
It is, but it's certainly endemic in the Northeast and Connecticut and Massachusetts, and it's way up further up north and certainly west and south. But it's so endemic in our community that there was some study done where, and this is a couple of years ago, and they think that it's growing. Is that 40% of the tick of the deer tick population is now has the Borrelia burgdorferi in it, and so that's just a huge number. So that's almost one out of every 2 ticks actually carries them. And there is validity to that. The tick has to be embedded in you, for more than 18 hours to really transmit the disease. But it's also very true that a lot of people, some of these ticks are so small, or people are so insensitive that they don't find the tick on them. They've been pulled off somehow or brushed off. They don't always find the tick. I've suffered from the disease 2 times myself, both caught and treated, and I'm not experiencing any secondary effects. But there are other things that need to be, and I agree that most human doctors up in this area, although they don't have a lot of experience with it, there are some that are have a great experience, and there's some that are not. But the AMA has set guidelines for the medical community and have taken a position which is not popular position with people in endemic areas, and because the people in these areas in a lot of the medical community just don't believe the results are as good as they should be.
Well, and to be clear, the AMA is coming out and saying basically it doesn't exist to give them 3 weeks of antibiotics and that's it. And if they're not better, it's something else. And
yes.
And for those of us that have lived through this, and in my case, they think it was probably a year or 2 before before I was ever treated and that the symptoms got really bad.
Well, exactly. And I've had a number of clients, and so the question, of course, is this a similar phenomenon in horses?
Yeah.
And the answer is we don't know. There's been Cornell and University of Connecticut have done some excellent studies, none of which have confirmed that there is a form of chronic Lyme's disease in horses. So there isn't enough research to support that chronic Lyme's disease can occur in horses. I think most of the practitioners in the area, like myself, we've taken a position where we listen to the client. We know that the animals have been affected, and in fact, with ticks, we'll test for them, and we'll sometimes see titers and sometimes not. I am not by the belief to treat a titer, an antibody titer. I think that there is a lot of horses in our region that have developed an effective immunity to fight off the disease or fight off the symptoms of the disease. They still may be harboring a living Borrelia organism in themselves, but they're able to function completely normally, that their infection is subclinical, and that their titer, their antibodies that they're producing, or some of the immune system byproducts, that be it immune complexes or some other aspect of their immune system, are effectively holding that disease at bay. And they have been able to, the researchers at Cornell, and have been able to, from horses that have been artificially infected, horses don't carry a load large enough in their bodies to be able to transmit it to another horse. So that's something that has been discovered. So when I have a horse that is showing anything from behavioral changes to unsoundnesses and unexplained behavior, locomotion, and I usually always do a titer on the horse. And then regardless of if the titer says negative, then I will repeat it, and I'll talk to the owner. If they're really adamant that I put them on antibiotics, I will do that. At the same time, if I have a high titer and the horse is asymptomatic, I will tell the owner that if your horse is showing symptoms that could be described as potential Lyme's disease with this high titer, I would have no problem treating your horse with antibiotics, although I prefer to treat symptoms and see if you have a response to therapy as opposed to just treating a titer. So is that clear?
Yes, that's clear. And I agree with you. There's a lot of horses that do test, and, they were testing and, for something else or whatever, and they find they do have it. And I think it's probably true in people, too. There's people that can fight it off better than other people, and then those of us that probably had a compromised immune system from something else got it worse,
And so I've had the experience with several patients that after treating their titers and these are horses with titers that I'm talking about, and with potential clinical symptoms that could be related to Lyme's as described with antibiotics. I have had some patients that have been on medication for 9 at a time, and their titers will not drop and the horses have been on doxycycline by itself.
Yeah, that's
and it's very interesting. So the question is, how is the drug being absorbed in these horses, in this horse, and these horses? So I've gone as far as now saying, well, let's see if we are getting true blood levels of the doxycycline into this, and sending out a study for the drug. And
well, does it? Are horses' immune systems differently qualified to deal with the different kinds of offenders? Like humans are.
Potentially, but we don't know. And it's there are the deer out there, the sheep, goats, cats. Very few of them show clinical signs of Lyme's disease. They all come in contact with that organism. They're all getting bit. So yes, it's reasonable to think that the animal, the horse, is that there's a large population that is clinically unaffected by them. But if you were to cow or sheep or goat, you would probably pick up some type of, if they have the right, pick up that they've been exposed to the organism.
All right, great. Well, we're plain run out of time. We certainly appreciate you being with us today and spending all this time with us talking about fun stuff. And, I hope that we can have you back and maybe make this an every couple month kind of thing. I think it's you're very informative and it's fun, and I think our audience likes this kind of thing also, talking more about horse health, which Helene and I don't do very often, so...
No, Jen and I do. We talk a lot. Then again, we can analyze horse stuff till the cows come home.
Well, I'll be happy to be on it again, and I can also, point you in directions of, authorities on particular issues if you want to. It's a fun forum to be on, and it is. This is a great idea for a program because it's sort of. It's what I do with a 4-H clubs, sort of a round table discussions with their veterinarian, and I enjoy it because I'm able to interact with those people and hopefully share some reasonable, some reasonable information that will help them take care of their pets better.
Great.
And if anything, it'll help jumpstart those dialogues that you say are so important to a horse's overall health, between the horse owner and their practitioner, the equine practitioner. Get the dialogues going, talk to your vets. And, if we can get our listeners to hear that from you, perhaps it'll help make at least one's life just a little bit better.
Hey, Dr. Parrott, you want to give out your contact information, your website?
Yes, absolutely. My website is parrottequine.com.
That's Parrott. Okay,
Yep.
parrottequine.com. And the phone number?
Is 978-468-6307.
And you're on the North Shore of Boston, there in Massachusetts.
That's absolutely correct.
All right, well, thank you, Dr. Parrott.
Oh, you're very welcome. It was nice talking with you. Very clear questions.
One more thing before we go today. I'm going to read you an email that we got from a listener named Sophie. And let me tell you, Glenn and I don't get a heck of a lot out of this show other than pure enjoyment. And it's emails like this that keep us going. It's wonderful. So Sophie writes, "Hi all. I hail from the dusty land of Down Under, and I am a fellow horse lover and rider. I found your show on the net sometime late last year, and I love it. Considering the extreme lack of horse-related items on television, the free-to-air coverage of the Beijing Olympic equestrian events here was shameful. And radio, it's great to find something like the Stable Scoop Show that provides horsey discussions through another means than traditional print media and websites. Just recently, my mom and I have completed the purchase of our first horse, a fantastic Morgan gelding named Samaria Creek Zephyr. We live in Sydney, that's Australia, and Zeph is going to be spending the first 3 years of his life on the stud in Victoria, so your show is a godsend for the 9-hour drive down to see him. And of course, we were thrilled to see that the latest Stable Scoop episode features Morgans. You can just put us down as recent international converts to the breed. Keep up the good work, because I'm not going to stop listening. Sophie from Sydney, Australia."
Well, that's a great email. I'll tell you what, we're glad that we know we have listeners in many countries, and it's good to hear from them. And, that's why we do it in podcast form and why we do audio, not video, is so that people can listen while they're driving to see their horse.
Yeah.
Or cleaning their stalls or, whatever, that they couldn't watch a video at the same time. So that's why we do audio and why we believe in it. And the Morgan show was very popular. I have to say, I just got an email from Julie Broadway, who was on the show, was our co-host last week. He was the executive director of the American Morgan Horse Association, and she wrote to me today that say folks, her Morgan people just loved the show.
Aww.
So she's getting a lot of good feedback from that show. So if you haven't heard the Morgan episode, and the cutest interview in the history of Horse Radio Network was on last week's show. It was by far the cutest interview. Jennifer listened to that, and she just melted. I mean, it is just I don't know how else to describe it.
That was one heck of a kid.
She was a fourth grader on the show last week, and you have to listen to the last week's show. It's the Morgan Show. Just look for it on the website at stablescoop.com.
Yeah.
Well, Helena, we have plain run out of time, and besides, the sooner we end, the sooner you get on a plane and come down and see us. So I wanted to mention to everybody, next week we're going to have a very special show. We have Helena with us, who's going to be here at our house, and coming over to the house too is Chris, my co-host from the eventing show, and also our eventer helper who's doing the play-by-play with us this next week, Samantha, who's going to be here also, and my wife Jennifer, and we're going to have a big roundtable wine and cheese party show talking about Rolex and reminiscing and talking about the event and everything that happened. So you'll get more of the personal side of it in our after show, which was what we'll do next week on Stable Scoop and the eventing radio show. We'll put it out on both, but we can all sit around, drink some wine, and chat about Rolex. I think that sounds like fun, Helena.
We're going to record that?
Yeah, that's right.
Wine and cheese? Okay.
And you know what? I'm not going to edit it either. What goes in, goes in. What comes out, comes out. So
you would never. All right, fine. What goes in comes out. That's fine. That's fine.
I said that wrong, didn't I?
I'm not held responsible for anything I say.
All right, everybody, send us emails if you want. Just go to the website and hit the contact button at the top of the page. And Helena, we will see you in a couple days here in Lexington, Kentucky. And we'll be back next week
with the Kentucky Scoop.